Hi, welcome back to All Things Home Care. It's time for Ask Dana. Today we're going to focus on questions we received about in-home services and what to look for. Patients have the right to choose their home health care provider. To get the highest quality of care, it's important to choose the home health care provider that is best suited for you and your loved one's specific needs. Before choosing a home health care agency, interview several providers and ask some of the following questions. How soon after discharge can a home health care services begin? Well, if you're looking to have skilled services in your home through a Medicare provider, generally speaking, a Medicare provider would have a registered nurse visit you in your home within 24 to 48 hours within discharge. But if you're hiring someone privately, that is up to you when you want them to start. You can have them even meet you at the hospital and ride home with you if that's what you wish. What is the admissions process like? Generally speaking, each agency will have a registered nurse do what's called a start of care. And upon admission, you will be seen by that registered nurse, and she will ask you the questions about your medical history, maybe take a set of vital signs, or if you're in need of a registered nurse for any type of wound care, she will be looking at the wound and coming up with a plan with your doctor for the best treatment for that wound. But generally speaking, you should be seen by a registered nurse within those 48 hours after discharge. How often can I expect home health visits? Well, keep in mind there's two different payer sources that we're discussing today. One is Medicare or managed Medicare, and the other is private pay. Under Medicare services, generally speaking, that the disciplines that will be coming to see you in your home, whether it be the registered nurse or physical therapist, will create a plan of care with both you and the physician. So that will be determined upon their evaluation of your needs. If it's a private pay home health situation where you're hiring the home care worker, it is based on what your needs and what you're looking for. A lot of times finances will definitely dictate how many visits and hours that they will provide services to you. Accreditation of a home health aid agency by recognized accrediting agencies such as Accreditation Commission for Health Care, ACHD, Joint Commission or the Community Health Accreditation Program, CHAP, shows an agency's commitment to the rigorous standards of excellence and quality patient care. Accreditation is not required by home health agencies, but allows an agency to demonstrate their dedication and commitment to the higher level of performance. Do you provide personalized care plans? I would say that most agencies have a personalized care plan. They should be sitting down with the registered nurse, the caretaker, and the individual, the patient or the patient's family, and to create that care plan. You know, what I always say is that not everybody wants to be bathed every day, or maybe they have a certain routine that they follow, and that's what the aides are there to do, to follow the care plan that best suits the needs of that individual. How often is the care plan updated? Well, again, this is something that is depending upon who is the payer source and what kind of agency you're going through. Medicare's care plans is generally updated every 2 weeks, whereas a licensed agency where they're providing the aid services is updated every 6 months. Well, that's all the questions that we have for today. If you have any questions, comments, or maybe a show idea that you'd like to discuss, email me at info@allthingshomecare.org.